Hello, everybody, and welcome. I'm really happy to have you here. I'm Chloe. I'm going to be talking about prolapses. But before we start, I'm going to hand you over to Natalie.
Hello everyone, my name is Natalie and I'm a complementary therapist and breath coach. And before we begin and get into anything too technical, we're going to go through a grounding technique using our breath just to drop into the room. So leaving behind all the troubles of the day and the worries of tomorrow, just to focus on the next hour together. Start by planting your feet on the floor, helping you feel nice and grounded, and your back in the chair behind you. And maybe close your eyes down. When you cut out one sense, it helps you to focus on all the others and cut out any distractions from around you. And now begin to bring your attention to your breath. You don't need to change anything, just notice. Are you breathing in and out through your nose or your mouth? Is your breath shallow or deep? Can you feel it in your chest or in your belly or both? Listen to any sounds that are around you other than my voice. What can you hear? What can you smell? What can you taste? Feel the chair supporting you. Just bringing your awareness back to your breath again. And we'll do some balancing breathing now. In and out through your nose. In through your nose for 1, 2, 3, 4, and out through your nose. 4, 3, 2, 1. In for 1, 2, 3, 4. Out for 4, 3, 2, 1. Inhale 1, 2, 3, 4. Exhale 4, 3, 2, 1. Inhale 1, 2, 3, 4. Exhale 4, 3, 2, 1. And open your eyes when you're ready. Hopefully you should feel a little bit more calm now and ready to listen to Chloe. Back to you, Chloe.
I was ready to have a nap after that. Thank you very much. Right then, let's get started. So at the end of this, I've got one of 3 offers that you can choose whether or not you would like. I'm really excited to share them with you, mainly because I'm bringing what I do face to face virtually. So yeah, at the end, we'll have a little chat about that. So let's get started with the presentation. I'm just going to share my screen, so bear with me for a moment. Okay, then. So, prolapses, when it decides to work. There we go, right. Taking this time. There we go. Prolapses by me, and I'm a pelvic health physio. Right then, let's get down to it. Okay, so first off, why would you listen to me? Why, of all the people out there, all the lots of people out there, why me? Why listen to me? So, one of my friends actually described this as my origin story when I told her about it yesterday. So I'm going to use that. This is my origin story. I qualified as a physio in 2009. Never in a million years would I think I'd go into pelvic health, but here I am. I had my daughter in 2019 and I had a with C-section. She was huge. Also type 1 diabetic. So it's safer really for me to have a C-section and have it controlled. What absolutely baffled me was the lack of aftercare. There was none whatsoever. And I was a bit put out, and I knew enough in order to rehabilitate myself and get my abdominals stronger and know what I needed to do. But the more I went to mum groups and spoke to other mums, I realized that nobody got any help. We went for this 6 to 8 week appointment at the GP who checked out baby, and it's good that baby's fine, but nobody checked on us. And I started getting really annoyed by this. So I retrained in pelvic health. Initially, actually went into kind of perimenopause and menopause side of things. And again, was baffled by the lack of support and care when it came to women's health. I would have women come in to see me that they'd been to the GP or a consultant or a specialist field and get told, oh, it's because you've had a baby. Oh, it's because of your age. Oh, it's because you've done this activity for too long, or, all these weird and wonderful excuses. And I was like, that isn't right. Like, we shouldn't just sit back and do nothing. So that's when I decided to be right. What can we do about it? And here I am. So alongside this, I'm also a Pilates instructor. I've been teaching Pilates for 10 years and teach a pelvic floor Pilates face-to-face where I live. Also a mum of two. And a fun fact about me, I used to be the tour physio for Shrek the Musical. I have zero musical capabilities whatsoever. Love musical theatre. The only way in for me was by being a physio, and it was great fun. Right then. What are we covering? So we're going to go over what a prolapse is, how do they happen, the symptoms you can get, the diagnosis, the treatments, but mainly what can you do right now for your symptoms? Okay, so a prolapse. Let me just show you. So this is your pelvis. This is your pelvic floor. So your pelvic floor works as a hammock, really, and holds your innards in. So a prolapse is when you get some pressure, something happens, you do have a baby, and that it pushes down, and some of the internal organs start to move downwards and cause pressure, normally into the vagina, and sometimes, unfortunately, out of it. So another thing as well is if you've had a vaginal delivery, you've got a 50% chance of having a prolapse. If you've had two, you've got 80% chance of it. But many women don't even know they have a prolapse. They are completely symptom-free, living their life with a prolapse, lifting weights, doing a gardening, going for a gym, but they don't know they've got it. Okay, so the common types of prolapses. These are the three main ones. You can get a cystocele, which is the bladder pushing into that space of the vagina, as you can see on the little picture. You can get a uterine one, which is where the uterus is pushing down, taking up the space inside the vagina, and then a rectocele one, which is pushing at the back as well. So they're the three main ones that you can get. Causes. Childbirth is a biggie. Also, perimenopause and menopause. I see a lot of ladies that have never even had children end up with a prolapse. Normally because of point number 3, chronic constipation. That is a biggie, and I'm going to cover that a little bit more in a moment. And also chronic coughing as well, is that continual downward pressure onto your pelvic floor. It gets to a point where it goes, nah, I can't do it anymore. And that's when the prolapse can happen. Increasing your weight can as well. So if you are slightly on the heavier side, that increases that downward pressure that you can get as well. Previous pelvic surgery in any area of the body makes your brain go into a bit of a panic, and it normally switches off the muscles in that area as a bit of a safety net. So if you've had pelvic surgery, the chances are it's probably switched off your pelvic floor muscles, because it's gone, oh, I didn't like that, I feel a bit sore, so let's just not use them. And then genetics. Unfortunately, if your mum had a prolapse, chances are you'll probably get one as well. So we come on to symptoms. You probably know your symptoms. Everybody's symptoms are quite unique to them, but there is a common theme to a lot of them. I would say the most that I hear when in clinic is at the end of the day, they feel that heaviness and that dragging sensation in their pelvis. Another really common one as well is feeling like a tampon's not quite in the right place, that you kind of need to shove it back up again. You can sometimes visibly see a bulge just in the entrance of the vagina, or unfortunately it can sometimes be external. Sex can be painful in certain positions. And then you can get those bladder and bowel symptoms too. So if you have got pressure, say, from that bladder pushing into that space of your vagina, as soon as urine hits your bladder, your brain goes, wah, I need a wee immediately, and you go off and you hardly produce anything at all. And it's because the bladder's getting all jigged around too much and it's sending messages to the brain that you need to empty it and it's full when it's not. You can just get back pain or an ache as well with no other symptoms, and that can be a sign of a prolapse, but also it can be just part that your pelvic floor is not working as well as it should. And then you can feel as if you're sitting on a ball as well. So diagnosis, extensive medical history. So if you came to see me, I would spend a good 45 minutes asking a load of questions to get down to the nitty gritty of everything, all of your symptoms. We get very familiar very quickly to find out what's been going on. And then a physical examination. So what I would say with physical examinations when it comes to a prolapse is, yes, have it done lying down, but you need to have it done stood up as well. Your prolapse works more with gravity. So if you are seeing a clinician at the moment and they're only assessing you lying down, ask to be assessed stood up. And if they're not happy to do it, find someone who is, because that's going to give you the real reason of, what grade your prolapse is and where you're at with it. Sometimes it is recommended to have bladder and bowel function tests. These are more for the severe cases that you need them. And then for complex cases, so this is normally your traumatic births where you've had big tears, is an MRI is advised just to see what is going on down there. Okay, treatment options, conservative versus surgical. As a physio, I'm always going to go conservative to start with. But the one thing I'd say with conservative treatments is you need to put in the time and effort. If you don't do them, you won't see any improvement whatsoever. It's as simple as that. People see surgical as a quick fix, but if you have a tight and a weak pelvic floor, that's still going to be tight and weak even after you've had surgery. So I'd always try the conservative treatments first and give them a good stint of time. Okay, so what are those as options? So first off, obviously, pelvic floor exercises is what I'm going to say. Pilates and yoga. So the pelvic floor is never just the pelvic floor. It always has to have support from other structures. So around your pelvis, you've got your big, strong bum muscles, you've got your tummy muscles, and you've got your back muscles. If you're weak in your bum and your tum, and most people are, something else is going to try and support you. And it's normally lower back and pelvic floor. And your body can cope for so long, and then it goes, I can't do this anymore. And you start to notice symptoms. So you need to make sure the whole of that structure is nice and supported and strong, and every muscle's pulling their weight pretty much. Estrogen cream can work brilliantly. So if you are more perimenopausal, menopausal, as we go into perimenopause, our estrogen levels will go up and down and dip. And estrogen is in every single cell of our body. And it will make it, particularly in our muscles, it will make our muscles weaker. So you could have been absolutely fine for years and years and years, and then all of a sudden you start getting these symptoms, and chances are it's because your estrogen is lowering. So if you use an estrogen cream, or you can even use estrogen pessaries that you pop up, they're little tablets that you use a couple of times a week, they just focus on that area. So it doesn't go through the rest of your body. It just works there to help heighten everything. Weight loss can also help massively because it just reduces that downward pressure on that stomach. And then pessaries, you can get pessaries that you just wear for the activity, and then pessaries that you can keep in for up to 3 months. So here we are to pessaries. So pessaries just, I'm going to use a technical term, this one, hoik everything up. They give that lift in the vagina canal to the bowel and the bladder and just calm everything down. And they just give it a bit of a, just lift everything up a little bit. Now, they can work. Some people absolutely fine just having a pessary and that's it. Jobs are good and they're happy just to have it changed every 3 months, and it's brilliant. But what they're really good for is that kind of breathing space of, okay, I'm doing everything else. I'm doing my breathing techniques. I'm doing my pelvic floor. I'm doing my Pilates exercises. And I know I've got the support of this pessary, so I don't have any of my symptoms. So everything starts to calm down and your brain starts to calm down in that area. So they work really well. The big thing is finding the right one for you. There are a lot out there, and it's working with which one works for you, because we're not all the same. Our bodies are all completely different, and it's finding which one works for you. And it can delay and avoid surgery. And that's the big thing. I've had a couple of people tempted with surgery. They found the right pessary and no longer even thinking about it because they're absolutely happy. And the one thing I would say is, yes, you can still have sex with a pessary in. Just going to put it out there. So I'm not going to waffle on too much about these slides, but these are the main surgeries that you can have, corrective surgeries if you want them. All I would say is, if you are contemplating surgery, is get some feedback, know what your surgeon's like, and stress to have pelvic health physio afterwards. The surgery isn't going to be that quick fix, jobs are good and done. You are still going to have to strengthen up the pelvic floor, strengthen up the surrounding tissues, make sure you're breathing properly for it to be successful. And I think that's where they don't tell you this bit. They just say, yeah, we'll do this and we'll fix all your problems, but it isn't always like that. And then these are the other ones as well. Okay, so why have I got Natalie here? Why am I rattling on about breathing in your pelvic floor? So your pelvic floor is part of your fight and flight response. So if you notice that your jaw and shoulders and your neck get tight as the day gets on, or if you notice that you breathe more at the top of your chest rather than your belly, I would bet good money that your pelvic floor is tight. And if your pelvic floor is tight, when you need it, it's not going to be there for you. So if you can show you my arm, this is my pelvic floor, my bicep muscle here, and it's tight, and it's because I'm stressed, and my jaw's tight, and I'm all breathing up my chest. So if I'm like, oh, I really need a wee, and then all of a sudden my pelvic floor is like, okay, I can only support you this much. I can't give you any more because I've not got the range of movement. I can't do any more. And you probably notice that you have a little leak. If you are relaxed, so you're like, right, okay, my neck and jaw is nice and relaxed, I'm doing some lovely belly breathing, your pelvic floor will go, oh, okay, I can lengthen as well. So when you're like, oh, I do need a wee, but I can't quite go yet, it goes, yep, no, I've got you this time. Yep, I've done a big, strong movement. Here I am. I've got you. We live in a world that is very stressful at the minute. And I would say 90% of women have tight pelvic floors. And if you have a tight pelvic floor, it will push down further on that prolapse. So we need our diaphragm and our pelvic floors to work together. Here's my pelvic floor, and this is my diaphragm. When I do an in-breath, I push down on my pelvic floor. But when I do that out-breath, it lifts up. So we need our pelvic floor and our diaphragm to work as one. So we're in this lovely synchronization, and it feels supported, and it's got that kind of like, oh, everything's lovely feeling to it. So that's why we concentrate on breathing. Why do we do Pilates? Well, your pelvic floor is never just your pelvic floor. So it needs support. Your bladder needs support as well. So if you are quite weak in your tummy muscles, your bladder has more movement. It's a bit more wibbly. So if you struggle from urge incontinence and key in the door syndrome, you know, when you've been shopping, you get home and you're like, I could do with a wee, but I'm not too bad. You get to your front door and you're like, oh my goodness, I need to go now. Key in the door syndrome, that's your urge incontinence. And that will be partly because of weakness in pelvic floor and partly because it's also tight, but because you've not got the strength in those tummy muscles in order to support you. So, like I was saying before, we need area around our hips and pelvis are nice and strong. So we need to make sure that your bum muscles are nice and strong. We need to make sure your tummy muscles are nice and strong. We need to make sure you're moving correctly. When you stand, we need your rib cage above your hips so that you can breathe properly. We need lovely movement through your upper backs and your ribs so that you can breathe and you can fully inhale your lungs and use your diaphragm. And that's where the Pilates comes into it, alongside with the breathing as well. And also it reconnects you with your body. A lot of women, when they have pelvic issue, and I don't like using the word dysfunction, but have pelvic problems, almost kind of go, oh, we'll just kind of, oh, it is what it is, and become disassociated with it and disengaged from it. And then that can lead to ongoing problems as well. So it just helps you become one with your body, getting your breathing right and strengthen everything up. Okay, I'm going to go through your questions that you sent me, and I'm really pleased that you did this. I'm so happy. One thing I would say is if you have got a question that I don't cover, feel free to send me an email and I'm happy to answer it. Right, can I lift weights with a prolapse and what exercises are safe? This is a really common one. We get told to do, don't lift this, don't do that, rah, 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 because you have this prolapse. I'm going to tell you, yes, you can. You can do all of them if you do them correctly. And that's where the breathing comes into it. So if you're diaphragmatically breathing, so you're doing lovely belly breaths and you're not bracing, you can lift weights. It's the bracing that puts that downward pressure on your pelvic floor and on your prolapse, which causes the problems. So you can, but you need to really practice that diaphragmatic breathing first and make sure neck and shoulders are nice and relaxed. You're breathing with your tummy, your pelvic floor is nice and soft, and then you can go for it and lift it. Can my prolapse be reversed? Wishy-washy answer for this one. I do apologise. Yes and no. If you have a mild prolapse, then chances are yes, it can. If it's more to the moderate to severe, no. But our aim as a pelvic health, my aim as a pelvic health physio is for you to reduce your symptoms. I'm not going to get rid of that prolapse, but I can help reduce your symptoms and then teach you how to keep doing it. So I'm giving you tools for your toolbox so that if your symptoms come back, and they probably will, but you'll go, do you know what? I need to do this. Or you'll know, they came up because I did that. And it's not a, oh my gosh, I shouldn't do anything ever again. It will be like, it's that clarity of knowing, oh, it's because I did that and I shouldn't have. But it's okay if I do this, everything will ease. Tips with help with constipation. This is one of my favorite things to talk about. Right. So constipation puts a lot of pressure on your pelvic floor. I think it's probably the worst thing for your pelvic floor to go through is when you're constipated. One thing is do not force it. Do not strain on that toilet because you'll make your prolapse worse and you'll really annoy your pelvic floor. So get a stool underneath your feet. When you get the call to go, get a stool underneath your feet so your knees are higher than your hips and lean very slightly forward. That actually opens up your bowels and makes it much easier for that stool to pass. Moo to poo, literally like a cow. You want to do that, moo, and it relaxes your pelvic floor. If that doesn't quite work, you can imagine blowing bubbles like that, and that will help soften your pelvic floor as well. The obvious, drink lots of water. We don't drink enough water. We're probably too busy. But try and get more water on and get moving as well. Just walking. If you can walk somewhere instead of taking a car. And then flaxseed's quite a good one. Throw it in yogurt, in porridge, on cereal. That just helps them naturally to get the system moving again. Okay, so bladder irritants. There's quite a few. Your caffeinated drinks, your alcohol, fruit juices, because of the sugars, carbonated drinks, artificial sweeteners, and spicy foods can all cause irritants. There are some pelvic health physios out there that if you ever do a bladder diary and they're like, oh, you've had a coffee and 45 minutes later, you need a wee. Oh, no, you shouldn't be doing that. Don't drink coffee. I'm not going to say that to you. Someone told me to do that for my coffee in the morning. Nope, I'd be having none of it. But if you came in and you had 12 cups of caffeinated tea in a day and you were peeing every 45 minutes, I'd probably say, can we do half of them as decaf maybe? Or mix it with water? Just to stop that bladder getting as irritated. So it's all about just knowing that these will irritate your bladder. And it's where they're like, yeah, do you know what? I'm going to pee in 45 minutes. I'm all right with that. It's just accepting it rather than thinking, no, I should hold it for longer. It won't happen. It's caffeine. It's going to irritate your bladder. Can I have sex with a prolapse? Absolutely. This is a great time to try different positions. Find out what works for you. Because one won't and it'll feel uncomfortable. But talk to your partner as well, because if you want to know, like, can you feel it? Or if you're worried they can feel it and you're feeling a bit self-conscious, talk to them. I know it's a bit of a one of them conversations, but I bet they're more than happy. You're talking about sex at the end of the day. They'll be more than happy to chat to you about sex. And then use lube. Use lube anyway. Even if you don't think you need it, use it anyway. Um, just because it will help everything feel nicer. Okay, so before we move on, I had a few more come through that I've just written down here. So I had a question about hyperpressive breathing. So basically, I don't know whether this is a new fad or not. Basically, hyperpressive breathing is diaphragmatic breathing, but they're just selling it in a different way. The breathing techniques that Natalie's going to go through are far better than the hyperpressive breathing. It's basically making sure that your diaphragm is working when you breathe and you're getting a good expansion through your rib cage in a nutshell. And then another one is for vaginal dryness. If you can't or you're not happy taking the estrogen creams, so you can use an estrogen pessary. That can work quite well. There are some nice, they're not really lube, they're lubrications, but not lubes. They're more kind of moisturizer is not the right word either, but they just add a bit of moisture to the area. So there's Yes is quite a good brand that do it. There's also DHEA, which is a natural hormone, and it's kind of it kind of boosts things naturally. So it's almost triggers kind of like an estrogen release to the area, which can work quite well. I would dabble with them and see which works for you, because you definitely, if you are struggling with vaginal dryness, do not ignore it. Make sure that area stays nice and lube, because you don't want that friction and then it to get cuts on it and soreness or anything like that. So using something, and it's just finding out what works best for you, really. So the main thing, the reason you are here, what can you do right now? So I am going to stop sharing. Oh, sorry. Right, let me get Zoom back. Bear with me for a minute. Go away, go away. Right then, and I'm going to pass you over to Natalie, who is going to talk us through some wonderful breathing techniques.
Thank you very much, Chloe. I found that absolutely fascinating. I have learned so much. Thank you. And I think it's so key to understand the link between being stressed and being in that fight or flight response and having a tight pelvic floor, and the way in which you can transfer from the stress response into a relaxed response to then help your pelvic floor soften, and the importance of that. So through the breath, you can both activate your relaxed, calm response, but also functionally, by moving your diaphragm, as you've explained, diaphragmatic breathing then helps your pelvic floor to soften as you breathe in and use your diaphragm. But of course, we're so busy and stuck in this stress response, the body's natural way of dealing with that is to chest breathe. And if you're only ever breathing with your chest, you're actually sending signals back to your nervous system that you need to stay in a stress response. So by taking control of that, using your breath and diaphragmatically breathing, you send signals back to your nervous system that you are calm and safe, and it's okay to be in that relaxed rest and digest state. So we'll talk firstly about how to use your breath to relax. And we're going to use a 4-8 breathing technique. And I'm actually going to teach you the ocean breath technique, which is a way in which you can control your breath even more so that you can get a really, really long, slow, controlled out breath. The ocean breath technique is a nose-only breathing technique where you imagine that you're fogging up a mirror to create a constriction in the back of your throat. And by ever so slightly narrowing your airway, that helps to give you that control, but it also stimulates your vagus nerve, which is an important part of your parasympathetic nervous system response, that rest and digest response that I mentioned before. So try it all with me now. We're going to imagine fogging up a mirror. You make like a breathy sound in the back of your throat. And now do it again, but breathe in. So you've still got that restriction at the back of your throat, but breathing in. Now transfer that through to closing your mouth and just breathing in and out through your nose. So you'll sound a bit like this. Hope you can hear me okay. So you've got that restriction here. It's closing off your airway ever so slightly and creating a bit of a whooshing sound in the back of your throat. Now we'll apply that to breathing in through your nose for the count of 4 and out through your nose for the count of 8. We'll try it together now. Feel free to close your eyes, get into the zone, and really allow yourself to be open to getting into a really relaxed state through this breathing technique. And we'll go together now. In for 1, 2, 3, 4, out through your nose, 8, 7, 6, 5, 4, 3, 2, 1. In, 1, 2, 3, 4, out, 8, 7, 6, 5, 4, 3, 2, 1. I'll do it with you now. So you do start to sound a bit like Darth Vader. This is totally normal. It means you're doing it right. And it does take a little practice to get the right balance between having a completely open airway and having it closed off where you start to make a croaking sound. You will find that sweet spot and it become natural to you to be able to breathe in this way. So that was the 4-8 relaxing breath that helps to activate the calm response that will then because it'll help your body to feel safe, and a safe body means a soft pelvic floor. Now we'll talk about diaphragmatic breathing. Place your right hand just on your ribs, so at the bottom of your ribs, and your left hand at the bottom of your belly. And now you're going to inhale. Try and use that ocean breath technique again if you can, and allow the air to flow down into your lungs and really feel it moving down and opening up your ribs and your lower belly. And then as you breathe in, feel everything gently recoiling, coming back in. And then inhaling again as you breathe in, everything softening and loosening down, all the way down into your pelvic floor, which will then again allow to soften and relax. And you keep breathing in this way. Get a feel for how your hands are moving in and out as you breathe in and out. Your hands moving out as you breathe in, and as you breathe out again, your hands moving in as everything gently recoils. So nothing forced. As you do breathe in, you're not forcing your belly out, you're just allowing it to loosen. A lot of people do find it hard to let go, and I think that in life we're so tight and tense and we're bracing in that stress response, fight and flight. We brace, we hold ourselves in, and also I think a lot of, especially women, we feel like we have to hold our stomachs in so that we look good. We're not used to just letting go. So just allow yourself to soften, let it all hang out, you know. Let yourself just relax and soften, because you know we're women, we're soft and relaxed, and just embrace your body and let it all relax and release. And that too will send again signals back to your nervous system that you're safe, that you don't need to be in that fight or flight tight response. You are relaxed, you're safe, and that genuinely will help to activate your rest and digest state of your nervous system. And as Chloe was saying, with Pilates, you are reconnecting with your body. And what I did with you at the beginning with that grounding technique was helping you stop thinking about everything else that was going on in life and bringing your attention back to your body. Just try and pause during the day, close your eyes and reconnect with yourself. Take some nice mindful breaths, deep diaphragmatic breathing, reconnect with your body and help switch yourself out of the stress response with that tight pelvic floor and into a calm response with a nice soft pelvic floor that will help you to carry out those exercises that Chloe is now going to talk about. Back to you, Chloe. Thank you.
Oh, that was amazing. Thank you. And very handy for what we're doing now. So I'm a pelvic health physio talking about prolapses. I cannot not talk about your pelvic floor. So my trusty model. Ta-da! I'm going to talk you through two ways that I teach pelvic floor contractions. And I found that you're either one or the other. You might start as one and then move to the other, but let's see how you go. So the first one, I call this the diamond pull-up. I think I should patent it as my name, but this is your pelvis. So this is facing forwards. I'm going to just flip it so you can see. I want you to imagine you've got a point at the inside part of your pubic bone, inside part of your tailbone, and inner part of your hip bones. Now, those points there are going to come together and then pull up towards your head. So you're kind of bringing them together and up. And you do that with a breath out. So first off, let's have a reset. Let's relax our neck and jaw. Let's do the lovely diaphragmatic breathing that we've just learned how to do and soften through that pelvic floor. Now, bring those points together. We're going to do a breath in, breath out, bring the points together, pull them in and up, and then just let them go. And then just make sure you soften, recheck, relax through your jaw, relax neck and shoulders, belly breathing, soften that pelvic floor, bring them together and pull them up with that breath out. Okay, so have a little bit of a practice with that one. Just make sure you're relaxing in between. It's not like, oh God, pull, 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 because that's going to end you in a whole heap of problems. So that's diamond pull-up. That's one. My other one that I do is called wink and zip. Normally gets a giggle. So trying to keep things professional, I want you to imagine closing your anal sphincter. For those that you don't know, this is your anal sphincter, otherwise known as your bum hole. I want you to close it, but it's not a big bum squeeze. It's just a little subtle one. Imagine you're in a lift with a load of people and you don't want to pass wind. So you don't want to do a big bum squeeze to clench it. You're just going to just slowly, no one knows what I'm doing here. It's absolutely fine. And then let it go. So you're just going to do a little bum squeeze and let it go. Now the zip part is, imagine from your bum hole, you're pulling forward and up to your pubic bone. So you're winking first, you got your wink, and now pull it forward and up, and then let it go. So try wink, forward and up, let it go. And again, it's that breath out that we do it with. Keep practicing on that. I'm going to explain the breath out because a lot of people say, I want to do it with the breath in. Here's what I'd prepared earlier. This is my intra-abdominal pressure. This is back being my diaphragm. So when you do an in-breath, you actually push down. That's all my internal organs getting squished. So if you imagine you're trying to pull up your pelvic floor, poor thing doesn't have a hope in hell. It's just going to get squashed. However, when you do an out breath, that diaphragm lifts. Oh, everything's nice and floaty there now, so that pelvic floor can lift as well. So I just want you to try and keep that in your mind. If you're like, no, I'm doing it with an in-breath. I've met a few people that point blank will refuse to do it with an out-breath. But they, bizarrely, don't improve. So are you a diamond pull-up or are you a wink and zipper? Do you need to work on it? Probably. You may also just feel it at the front or just feel it in the back. You may feel a little bit of something, but you're not too sure. All of this takes practice, and it's about getting your brain engaged with your pelvic floor again. So the next exercise we're going to do is wear this rolled up towel, or the towel I told you to get. Rolled up towel, yay big. It looks massive. It's not that big, about that big. And I want you to sit on it front to back, like so. Let me put it this way. So you kind of feel it all underneath, in between your sit bones is how you're sitting on it. Now, reset yourselves. I say this, say that a lot. Relax neck and jaw, belly breathe. Try and imagine that pelvic floor is butter in a pan and it's melting. All those sit bones are moving away from each other and it's softening. I then want you to do that pelvic floor contraction, whether you're a diamond pull up, wink and zipper, you're going to do a breath in, breath out, you're going to just pull up, or you're going to wink and zip, and then let it go. And what I want you to feel is the let go. I want you to feel it relaxing on that towel. Imagine that kind of really softening. Don't push it, just softening it down. And you may notice that when you soften your pelvic floor, your shoulders might come away from your ears as well. So let's try it again, because this here gets your brain re-engaged with your pelvic floor. So if you've had surgery, traumatic births, or long-standing pelvic health issues, your brain has probably gone, I want nothing to do with that, which isn't helpful. So it's just getting that brain involved. So let's just try it again. So reset, relax neck and shoulders, belly breathing, soften that pelvic floor. We're going to do a breath in, breath out, pull up, wink and zip, and then let go and just feel something on that towel. It may be really subtle. If it is really subtle, keep practicing, because it's just getting the neural pathways from your brain to your pelvic floor back on. And it will be a little bit sluggish. And then all of a sudden, like a light bulb, you'll go, oh, I can really feel it now. And that's how quick it will be. In a few days, that normally happens. So practice is key with that one. Your pelvic floor, but more relaxing it. In my classes, it's all about relaxing. If you would like any more information from me, or if you'd like to follow me, I am at CE Physio Pilates on Instagram, Facebook, and I think TikTok, even though I'm just coming around to TikTok. That's my website address. And then you can always reach out at Chloe at cephysio.com. Anyway, I think that's us done. Thank you so much for joining us both. I've had an amazing time chatting to Natalie and learned loads. I don't think this is going to be a one-hit wonder for us, Nat, to be perfectly honest. I feel we're going to be back with more.
I agree, definitely. It's been fantastic working with you, Chloe. Thank you.
All right then, everybody. I hope you have a lovely day and speak to you soon. Take care now. Bye.